afternoon. Welcome to the session of Well Bodi Talk program, where they come to you every Sunday, live from Radio Maria Salon, the Christian voice. Now you host. Remember, say the program they come to you live from we fourth floor studio, na 10 outlet Vito, 90.9 FM, 91.7 Abo, 90.7 at Kenema, and 101.3 inside McKinney. With me today at the studio, na Dr. Samuel Bello, we don't always they come na the Well Body Talk program, but because of one or two activities them in not a day. But today, they will tweet for can talk about one very important topic. And for that, we start this program better one. We will start for prayer now in the name of the Father, and of the Son, and of the Holy Spirit. Amen.
Amen.
Glory be to the Father, and to the Son, and to the Holy Spirit, as it was in the beginning, is now, and ever shall be, world without end. Amen. Famble them. Now, so we go welcome una again to this program, Well Body Talk, where they come to you live from Radio Maria Salon, the Christian voice. Now you host. The topic where we want talk about today, na very important topic where most of the time we don't dey ignore or we not even see say it dey exist or it happen. We mostly they think and out there for say woman dem na dem infertile, meaning na woman go dey something after e born im first pikin, e no able for get belle again for born another one, or e no get belle at all. So we want for the people know say today man themselves dem can be infertile. So now that make today Dr. Bello Denaya with me for let we talk about the topic. Do you know that men too can be fertile? If you not be know now for say man themselves can be infertile. Me where they bring the program come na gifty massacre. Dr. Bello, you can tell Fumble there I'll do, and you go make let them know waiting na male infertility.
Family una do una afternoon. As Sister Gifty don't just introduce me, introduce the topic. This is a very big topic and very interesting topic. And in our settings, African settings, normally most people accept otherwise. Most people, especially our people in the village, don't believe, say man can be infertile. But I want to assure everybody here, as the program get for the go on, man can be infertile. In fact, statistics don't show we that out of 100 couples, most times the infertility where they exist, maybe what you mean couple, mommy and daddy where they married, they sit down together. Out of 100, 13 of that then cases, then you find out say then couple they don't able born. The case, the person responsible for that, na man, not a woman no more. So this they show we say not a woman no more can get infertility. Man they contribute. In fact, as we go along the discussion, we find out say 1/3 of infertility issues where they exist within couples, man they contribute towards a man responsible for 1/3 of that. So that is it. So what in a really male infertility as we want actually start this topic. As I don't say that a very big broad topic. But we'll try with level best because of time and other thing. We really try for explain in a simple term so that we will get the key things, simple key things, and a take-home message we'll be able to get up. Male infertility simply means man not able for start pregnancy within a family, that are the man and the woman. You're not able to get what it simply means, you're not able impregnate or give belly to a woman. Series of reasons stay for that why it man not able give belly to in wife. Even if the wife, everything not wrong with her, nothing not wrong with her, he get every ovaries then they in sexual reproductive organ well accurate, but man not able to still get belly. Nine male infertility. A couple of reasons there for that as we go along. So now that na male infertility. man not able to give belly. In sperm not able to give meet the egg and give belly to in wife. Simple, in simple terms.
So 13% of the man dem out of 100%, 13% of the man dem sef can play a role for the woman not able to get belle for me e go born. Na that's na the summary of this introduction wey Dr. Baylor don tell we. Woman for get belle, man for able for give woman belle. But however, we get percentages of men wey no go make woman get belle. Reasons dem dey for that. And as we dey say, no mean say some infertility e go get for tell with types. There are times the man or the woman can don get them for get first belle, then second one e no possible after so many interventions, whereas some not even ever get am. So you get that experience or you get somebody where they go through am na for listen, because inside salon most of the time we get boku myth. Yes. Where people can say na this na the reason, we get him for talk, na that na the reason. So many reasons them. Yeah. And most of the time the reasons they tied are against women. That's na woman them not born, na woman they not able get belle, na woman they not this, failing to realize that the man themselves they are a contributing factor in some instances why the woman not go get belle. So family, if you just dey join, remember say this na the Well Bodi Talk program where they come to you live from Radio Maria Salon, the Christian voice na you host. And this program they come to you every Sunday 4 to 5 something with Master Sabi people from the Well Bodi workplace. And with me today, I get Dr. Samuel Baylor for help me rub mouth on the topic. Do you know that men too can be infertile? You know, be ever know? They know that they say 13% of married couples, the man and the wife don't marry, 13% of them man then they get the possibility not for able for give woman belle. Yeah, so now that's we they explain today for let we fumble them out there. No, it might be say you get family member where they go through that crisis, or you said they go through that crisis, but you no know, you always feel say na the woman, na the woman, na the woman. So doctor don't try for make we know waiting na male infertility. I don't know if you can help for the fumble them, demand them. Of course, with the reproductive system, the woman then get a you, the man then get a you. People can try for know waiting at this the thing that we make up
the male reproductive
the male reproductive system. Yeah. Because when them begin understand that side, then as you they go in, because sometimes some problem get for the
along the
relating to any of them
sure,
and
sure.
where them go able for understand. Or if they're not on be victim of then go able for prevent certain things now for me they not end up for be man they will go be infertile in the future.
Yeah, okay. Yeah, the male reproductive organ, it just sound like when we talk about the female reproductive organ. We will go at least secondary school, in that we kindergarten or secondary school level that they teach you basic male reproductive system. But this one, I just briefly go through waiting the male reproductive organ composed of inside man for this particular topic, because time is of essence for we. So one, the male reproductive organ consists of the testis, that bolocus, where would they call bolocus? Then I would call the testis. They're part of the male reproductive, a system, not a one organ, but you get series of organs. And when you put the organs then together, now they form the system. Now we would call a male reproductive system. Not a one thing they cause that. The first thing that the testis, the bolocus. Then the scrotum, that the bag where they hold that bolocus. Now we call the scrotum. It is part of that system. We get the spermatic duct, what we call the spermatic duct. That they actually the sperm can be produced and travel. They call a duct. Now duct now like a passage, you know. And this consists of two key organs there. You get the epididymis, outside the sperm cell where we get for talk about where it produce them. Then also we get the vas deferens, that is outside the sperm they travel. And any of their organ here where are they called, so as they come along, some of the causes of this infertility are treated to their organ here. If the vas deferens or the spermatic duct block, Even if the sperm produce, they able come on, they go. So then thing all we go get for can know about that. Then the we get the male accessory glands. And then male accessory gland consists of the the seminal vesicles and the prostate. We be done, I think once of time we don't talk about prostatitis.
Yes.
A small organ where they around the urethra, we say the piece the pass. That organ they it is part of the male reproductive organ system. So the prostate also is very important. If we can remember this discussion, last we'll talk about prostate. We say they produce that water we can dip at the sperm, where they make the sperm they flow fine, in that they get in nutrient, they travel, now they produce them. Then we get the penis incessant, the part of the male reproductive organ. Now we also be. Now that you penis, na part of her. Then of course we don't talk about the seminal vesicles, the vas deferens. This now the various organs the way they consist the male reproductive system.
So Fambul, thank you, Doctor.
Yes.
Fambul, that's the voice of Dr. Samuel Bilo, where they help me for talk about male infertility. We will not know say man they can be infertile. Let me know say we get 13% of married couples then where if they're not born picking, reasons can be
As a result of
as
the man.
a result of the man,
Yes.
not only the
The woman.
woman. The man self can get problem. So now that make they don't take in time for call all the organs they're waiting day inside the system, waiting make up of this man in system, what they call male reproductive system. And at times it can be say one or two of their organs can get problem. Either something from childhood as you they come up or infection, all can contribute, or any other reasons or your family history. So as doctor don explain to we small, Agwame it make people know few of the causes. As you say, na a very broad topic. We're not able to talk about all things today, but inside salon or normally for then the man them, waiting are some of the problem because they can get a man to man talk them. Waiting are some of the causes where they make man them infertile.
That's a very important uh, question and a very important let we know this now. Um, then causes then many, as sister don't say, but because of time, we did narrow down to the key points then, the key one then, where really most of the infertility are associated with then causes then. One, the abnormal sperm production. What do you mean by that? The quantity of sperm where you supposed to produce the semen, the sperm, not reach to the amount where they produce for let it go a give belly to the woman. That's one. The then normally one of the key investigation where normally we can go to doctor can first way say let we investigate this man for infertility. They say let we do sperm count. So that sperm count you get for check and that based on the abnormal. If they produce abnormal sperm that cause that infertility. Then number two, the undescended testicle. I've been telling you say today one of the organ na the bolocus and that's what Creole man call it.
Yeah.
The bolocus. And that bolocus dey enough for the up, enough for go dey inside your belly. If for count down, it dey inside that sack, that bag. What they call the scrotum. So if by any means one cell, because na two can normally dey, if there is maybe abnormal condition where some pikin dem dey born there undescended testicle, one not can count on, one not dey, or even like by along the way wey dey grow, one just lost or it go up, na you no count down, then that na one cause, that na another cause because not today is supposed for the not for the inside the belly for condom. There are reasons for that because the sperm where now inside the sperm where you get for use for give that belly to the woman, now they produce. And that sperm get a specific temperature. If it is inside that belly, that temperature because it is the nature that in a high protein, so it kill them sperm then. So if for they don't, where it would adapt in own temperature. Then one, if it not descent, it not they don't, then one causes where they cause infertility in men. Then Genetic defects. Genetic defects, then some people then they definitely, as a result of hormonal or genetic defect, what then a big word. You gene then, you know, the mix up and all the rest. That they cause also infertility. Then we get another defect is enlarged veins in the testicles. You know, the testes get veins the way the blood vessels they travel, the blood they travel. And then veins then they if they enlarge, what they call them, there is a big word for it, varicocele. Varicocele, if that means the veins then they enlarge inside the testicles. When they enlarge, they also lead to abnormality where they lead to infertility. So all the conditions then the way I don't show, and even also the commonest one also as a result of infection, bacterial infection. You know, you get infection caused by bacteria, especially chlamydia infection. You get also gonorrhea infection because this one is very common now among we, now the African setting or within Sierra Leone. Of course, now one man don't know where you don't reach then this age now, or you don't even reach puberty, where you don't know about gonorrhea. Gonorrhea is one of the things that they cause infertility. Now, make what they can always advise if it persistently they get gonorrhea infection, 10 chances to one, if you prolong, you don't treat them very well, it can lead to infertility. Also, chlamydia infection. We get down there on a laboratory, they prove if your infection is as a result of chlamydia. Also, we get moms. You get picking them. In fact, we get vaccines now we can give for the thing. You get picking them when they born, then they develop moms. And then one and they, if they don't think they don't, you not treat them with time, then they result to infertility in there, even as they grow up. Then you get also virus infection like HIV, other causes of infections, then they, like diabetes, then causes it lead to cancer also. It can lead to infertility in men. So these are, for briefly, these are some of the causes of infertility in men.
Briefly, this now some of the causes for a man not able to give belle. Some of the causes then, but who causes them? They but now some of the causes then this. One commonest one na the infection we doctor talk about the infection because when some man cannot get the infection and not they complete the treatment where they don't put her on am or where they don't get the infection they can say carry with your partner let them treat on her too. So man don't know the right person we get the infection so you don't know that for carry it. I go call in wife for say I don't get infection or doctor say law to go for treatment. So it can be another challenge. So if you they take and the other person you know they take her, you know the well. So infection very very key. And then the undescended testes,
Yeah,
where
important.
the mama or the healthcare worker outside this baby deliver this male child, they get for doing physical examination and see say the testes that they inside the scrotum. If not, for me then try for get an intervention for see if with time it go descend or if it not descend, if they go think for do surgery. So all of them thing there are just few of the causes them we doctor don't try for rub mouth pan. And doctor, with this few causes them, of course, the low sperm count, some man not go know say he get low sperm count, he go tell say he dey get sex with him wife, he dey do this, he dey do that, but still let the woman not dey get belle. And also as we dey go on, we go get for explain in detail. But how we go say the signs and symptoms, how the man go actually you know say or whose signal he go begin get for let e ginger am for one go see doctor
Doctor,
or go
fine.
na the well body work place for say so and so dey happen or that na the man wey really genuine or sincere wey bold enough for come out because of with all this you no go discuss it in well or you no go come out plain you go just keep am concealed. So wetin na some of the things dem wey go show or wey this man go dey experience wey go actually tell on am say yes na this na the
Okay,
problem.
yeah, we get certain things that we call the signs and symptoms. Signs na thing the way more or less you dey see it dey happen to you. You dey able to know how your body, what how it be done day before and how it done the day now. You dey envisage some of the difficulties then. The symptoms it just show you like you understand like they get some difficulty in certain things where you don't do before. But Naina, what we call signs and symptoms, where they point to you. But the signs and symptoms of infertility specifically, now they can mention them now as we go along. One, difficulty in ejaculation. What is ejaculation? Ejaculation now a process because some people they mistake that when they erect, when the penis erect, then now the penis thin up. Now in ejaculation. No, not in ejaculation. Ejaculation is when the penis don't erect, till to the point when you get on that sexual act, then you release the sperm. That release, the penis release the sperm, take into the vagina of the woman. Now at that point, that peak, now ejaculation. So the process of just erecting does not mean you have ejaculated. So ejaculation, when you get that difficulty in releasing sperm, your penis can snap. You can get the urge, libido, what would they call it, libido? You can get the urge for sex. Your penis also can snap, erect, but the sperm not the ever come. They ejaculate. If it or they find it very difficult. Sometimes they nothing. They get that point. They reach orgasm. They reach that point. And one that difficulty in ejaculation. And one they show that one sign they show you say there is something wrong, that is infertility. Then reduce sexual desire. Now what they call like lack of libido in the big term. They get sexual desire. Even if mostly it happen with as age they advance, that with the candy. But young within the ages of puberty, 22 going to 35, if you always get that urge or get that sexual desire, if you within that age and even above, because we get for reach to a point wherein question the way for if man stage the way it is stop for produce sperm. Like in hasting for say now, sperm can be produced throughout man in life. But the only thing, the rate, the reduction, it reduce as age they advance. So, but if you get that 80, you don't get that urge, that sexual desire. And at one sign, now for go see your doctor straight, explain to her, say, doctor, and then they get sexual desire. Then difficulty in maintaining the 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 thing, what do you mean by that? They able to maintain the secretion. That's how you release. They able that difficulty. You find it very difficult for maintainer. Then of course, pain, swelling. When you get pain, you get swelling, or you get lump in the testicle. That are the seed, the ball of us. When you get pain there, the testicle swell. Then also you get lumpy, like you just swell like that. That is sign for infertility. And for see doctor, what did they cause that swelling? What did they cause that pain? Mostly infection. They lead to that pain. When they release, they get that difficulty there. Then also recurrent re retrogression infection. That are recurrent infection. I don't already mention that. When you constantly get infection, they treat them. Or even if you treat them, but after you don't get infection this month, the thing, you don't get them back after 1-2 months. Then recurrent infections and they lead to infertility. And that is the reason why, as sister been rightly say, when you get infection, you as a man, normally when you go to any hospital, they tell you say where you partner. Be it man or woman, they will ask you because if you get infection, we don't go treat you. Then you left your partner. It is possible that infection if you don't pass on to your partner. Even if you alone they treat you, when you go there back, you get forgetter. So that recurrent day, it affect you, the man, continuously if you get that infection day. Then retrograde ejaculation. This is a very big word. Retrograde ejaculation also can cause you for being infertile. What is a retrograde ejaculation? I don't tell you say ejaculation now a point wherein it sexted onto orgasm, wherein the sperm will be deposited into the vagina of the woman. But in this case, Retrograde ejaculation, or you don't ejaculate. You dey feel really say you don't ejaculate. You dey feel that you dey get that orgasm. But the sperm no dey can at all inside the female vagina. You know, they go deposit inside the vagina. On a very small, they reach there, if at all it reach there. But sometimes you know they reach there at all. If they go back, it will be deposited into the the bladder. You know, the bladder they part of also maybe that one another organ where it associated with the reproductive, I mean the male reproductive system, and also both male and female. Mhm. The urinary bladder. So instead of the sperm go, it come out, it deposit inside, it pass through the urethra into the through the penis into the vagina, and they go back into the bladder. So as a result, now either you know they get sperm at all deposited into the vagina, or na very small, and you would already tell you say you get for deposit a particular quantity of sperm where go able go and fertilize the egg cell. So if that retrograde, the sperm they go into the bladder, it they create a lot of problem. And how you they know this one are dismissed and quickly? How you they know say they get retrograde ejaculation? It's very simple. That you they feel really say you don't reach orgasm. But number one, the woman or they ever sense the sperm inside in vagina, or even if you sense that very small. Then number two, if you want to know that, immediately when you grab where you go wet, most times the wet will become cloudy instead of clear, because that sperm don't go back, it don't go into the bladder. And that you know say sperm normally a grayish thick, yeah, yeah, and a cloudy. So when you go back into the urine, it make the urine look cloudy. So if you begin get cloudy urine, if not to infection, then go to your doctor, make them do further investigation. And you they get actually orgasm, but you find out say the sperm not they be deposited at all into the vagina. That's another problem. So go for further investigation. There are ways they can able rectify that. Some actually male infertility can be corrected, but some it cannot be corrected, honestly. That even books research have told us. So, but some can be corrected. Thank you.
Thank you very much, Fumbled Him. That's not the voice of Dr. Samuel Bilo. And me, where they bring the program, come to you from Well Bodi Talk, na Gifty Masakoi. Remember, say this program, they come to you live every Sunday, 4 to 5 something. Today, we dey ask the question, do you know that men too can be infertile? The answer na yes. Man themselves can be infertile. Man themselves not able, then they were not able to give woman belly because of all the reasons there are, where doctor don't say, and more other reasons. So if you na man we don't observe any of them points there where doctor don't say, then you need for be bold enough for go see doctor in hospital.
Yeah.
And if you na wife, you observe then thing there where doctor don't say for you man, then you need for take the correct step for let una go see doctor, so that una go able to get the correct treatment and the correct advice. So that's some of the causes them. And members say 13% of married couples, they are responsible for infertility, and that 13% say go to the man then. So do ya not a woman then no more. The man themselves gets the role for play. So if you see say you they observe any of them away doctor don't say on the Senate testes, you they get a premature ejaculation safe, eh?
Yeah,
Premature
yeah,
ejaculation,
yes.
or you dey get retrograde ejaculation,
Yes.
any of them wey don see, or you don't get infections wey repeatedly, or in order to dey complete you treatment for infections, and you dey get other observations, so you dey even lost libido, you not even get feeling for get sex, all of them things they are, apart from the aged, as you say, get them for talk about the aged, because there are certain medications where the aged self they use wey can lead them for get loss of libido, not to for infertility or fertility and all.
Sure.
So fambul them today, the program where we they talk about now male infertility. You ever know say man themselves can be infertile, meaning man themselves can they're not able to forgive woman belle. You don't observe that, or you don't go through that challenge, or you get fumble where they go through that, or you not wife where they go through that, or you not man where they observe any of them few things there. So we doctor don't highlight. The hospital do not open for you for go and get advice and go and do further check for may you mind clear or may them guide you for put you at the right side. So we they go now for a short music break. Don't forget say the program they come to you now we fourth floor studio 10 Santano House now 90.9 FM 91.7 Abo 90.7 Akenema and 101.3 inside McKinney. You call and you message is self important to we. Don't forget say the phone lines them open at 0799009007 or 0773151147. You can call now and make your comments. We dey go now for a short music break. We will join on back very soon.